But, portability over state lines that you brought up is very important. And a lot of folks in the U.S. still get their, like the average working man gets, which is what I was doing. I was an engineer for 8 years before this. You get your insurance through the employer. And while I defend the right of, employers to basically try to attract the top employees through the best health care plans, the fact of the matter is, like, it's tied to your job and it goes to this HMO system, and you pretty much get, every year you renew it. And one of the problems that comes up in this government-sponsored program is, let's say, tomorrow I have a heart attack. When I come up for reinsurance, they might deny it and say, you have a pre-existing condition.
Mm-hmm.
And in some cases, it does put you in a different risk category, like you said. But what the free market could develop and could bring, if everyone will think outside of the box again just for a moment, if you have the government outside of it, if you have these HMOs outside of it, and the consumer wants to, have their health care insured for a long period of time, there's nothing to prevent an industry from attempting to offer multi-year contracts, whether, 2 years, 5 years, 10 years. People start off, okay, let's say I'm 30 years old. I want to start, a health care plan for, 20 years. And I'm pretty much, I pay the same premium throughout the entire time. If I have a heart attack, you don't have to worry about this premium hopping up. But it still takes money away from that pool that you're paying into. So, like Meghan was saying, there is no free lunch. There is no such thing as free health care.
Right.
But that's the whole idea of insurance: is individuals banding together with pools of capital to assist them.
Let me jump in here and add one more dimension to this idea of if the insurance industry was deregulated. In other words, if the government quit telling the insurance industry what they could do, meaning, what they must do, and we'll call those mandates, and what they cannot do, which are called restrictions, of course, then we would see features in their offerings like we can't even imagine right now. I mean, today, it's kind of like we have, I could use this analogy, we have a car that basically has a steering wheel and an accelerator and wheels. and what we can't even imagine right now is that due to the competition that would be required, and by the way, would be readily available. I mean, heck, there's 1,300 companies already willing to compete in this thing. You would be sure to have, a lot of features come out of the woodwork. We would have the equivalent of all kinds of things, tilted seats, heated seats, various different entertainment options, et cetera, et cetera, et cetera. And people could pay for those or not pay for those according to their particular needs and desires. And so the market always responds with greater choices for people, and people choose those, and those are the signals that the people then who are running these companies use to decide what they want to offer to everyone. So it's a very practical kind of approach that when you think it through, these particular restrictions that are imposed on people, which by the way most people don't even know exist. Most people aren't aware of this restriction on health insurance providers. It really could make a very giant difference in how we would operate. I want to spend a couple of minutes while we still have just a little bit of time left in the show to talk a little bit about how we got here. Most folks don't remember or even know that it was Harry Truman back in 1945 that actually sent a message to Congress asking for the legislation establishing a national health care insurance plan. And 2 decades later, on July 30th, 1965, then ex-President Truman was the first to enroll in what just got passed as Medicare, part of Lyndon Johnson's Great Society, which, of course, as of right now, we know is creating an incredible amount of unfunded liabilities to the tune of many, trillions of dollars. In fact, between Social Security, Medicare, Medicaid, we're looking at bankrupting the entire United States, according to the GAO, and you can look this up, the Government Accounting Office, in their fiscal wake-up tour. So then we go to 1973, the HMOs, and so on. Every particular step of government intervention has taken us further and further away from the doctor-patient relationship, where we paid for our routine exams and we maybe had insurance, which most people did not, or catastrophic kind of insurance. So this is, based on my study, the general overview of this. I'd like either of you or both of you to comment on that, right away.
Well, after that brief history, it really puts it into perspective. I would have to say, and going back to what Walter Block says in his lecture, he comments that we definitely have a market for bread and other types of groceries, and restaurants take advantage of people's hunger. So why not go ahead and take advantage of people's needs for health care? I mean, it's not wrong. It's not morally wrong. We should maybe
have food socialism?
Yeah. I mean, we can have bread lines and rationing. I mean, that would be basically the equivalent of what we would have if we had it for health care.
Because food's too important for us to figure out on our own?
We need food, just like we need health care. People will die without food. Some people will die without health care. And it's just a question of, is it the government's responsibility, moral responsibility, to make sure that everyone's healthy? And the answer is really no, it's not.
One of the objections that we see about this idea of healthcare is that, people should not take advantage of other people's needs. But, like you just say, food is a need that we have, and as is healthcare. So, folks, as we've been talking about this topic for the last hour, it seems like there's a recipe of several ingredients that actually we can point to that actually all have significantly contributed to the increased costs that everyone has, the problem that we have in healthcare, the problem that we see in healthcare that is, very much in everybody's focus right now. And I list basically three things that are most significant. One is increased government intervention, insurance companies not being able to compete across state lines, and this monopoly or cartelization of the medical professions and professionals and medical schools. So, Jake, I want to throw it to you. What do you think?